The triggers of an asthma attack, are there more than one? I just thought all of a sudden you start wheezing.
Number of triggers, and if you're an asthmatic, a key to preventing asthma symptoms is recognizing, avoiding your triggers. Classic triggers, infection would be the most common.
How does infection trigger asthma?
Things just as simple as the common cold, regular viruses that don't cause much trouble for some patients, for asthmatics can lead to severe asthma attacks, inflammation, bronchospasm.
Okay, infection?
Exercise, number 2 trigger. Again, we do want people with asthma to exercise, but we have to take appropriate measures so that they can do that.
If they use an inhaler before they exercise, does that usually keep them from wheezing?
Usually, but occasionally it doesn't, and they need that anti-inflammatory drug, the inhaled steroids that we talked about earlier.
Gotcha. So we've got infection, we've got exercise. What are the other triggers?
Allergies. We can't forget about allergies. Most people with asthma have allergies, and we need to know, what are you allergic to? Because certain times of the year, they're going to have more problem than they do other times of the year.
Give me some examples of that. How can allergies do that in the spring?
In the spring, of course, we would think of tree pollen, February, March, April, May, grass pollen comes in behind that, allergic inflammation in the nose. But these are small particles. We can inhale those into the upper airways. Leads to allergic inflammation, bronchospasm, wheezing, shortness of breath.
Fall pollen, ragweed?
Yeah, fall pollen, ragweed, weeds, common triggers.
How about dust and mold?
Yeah, oh, absolutely. Dust mites, very common trigger. Cockroach. Sometimes molds are important. In fact, I often will use sensitivity to a mold called Alternaria to predict that these young kids with wheezing will go on to develop asthma.
Wow. Other triggers that are important?
There are, in different patients, different things. Emotion sometimes can be a real potent trigger for asthma in some patients.
So it can make people have an asthma attack if they get upset and start coughing, get excited. Yes. Cold air, warm air, which bothers the lungs?
Cold air, it tends to be more problematic. Cold, dry air, and if you really want to trigger it, cold, dry air and running or an aerobic type exercise.
How about cigarette smoke?
Yes, absolutely. In fact, cigarette smoke decreases the anti-inflammatory effect of the inhaled steroids, so it's counterproductive for our asthmatics to smoke.